This is a demonstration of the virtual fracture clinic, or the VFC. Normally what happens is when patients are seen in accidents emergency, they're diagnosed with a fracture or an injury, which following assessment by the A&E doctor, emergency nurse practitioner, who it tends to be, they are then traditionally referred to a fracture clinic based on their assessment. So the patients will get a certain degree of urgency, either, for example, if it's colour coded, it'll be red, amber or green, and according to that they'll get an appointment. This used to mean that patients on average, certainly in this trust, would take approximately, with your average patient, so an amber or green patient, some takes somewhere between 7 to 10 days to be reviewed by a consultant, both in terms of their clinical history, in terms of their imaging, and a review of your clinical case, on average 7 to 10 days. Since the implementation of the virtual fracture clinic, as you'll see from the presentation, this has improved to less than 24 hours on average. That is, a person who is then referred electronically into the virtual fracture clinic is reviewed in terms of their case and their imaging by an orthopedic consultant within 24 hours in a huge majority of cases. So if we look at this pie chart here, since the implementation of the virtual fracture clinic a few months ago, we have seen a total of 2,198 patients. Of those, the outcomes from the patients are they're either discharged, they either get a fracture clinic follow-up, or we refer them to the GP or physiotherapy. If we think that the patient needs to be seen much earlier, they then have what's called an urgent recall. So of all of those patients, 2/3 patients will have a fracture clinic follow-up after their assessment within 24 hours. At least more than 30% are discharged, i.e. they are discharged to the community because these patients do not need to be seen in fracture clinic. So we've got patients who were previously seen in fracture clinic. These patients do not need to come. They don't need to pay car park charges. They don't need to take time out of work. What happens is, after they're reviewed, one of my virtual fracture clinic staff will, after review, will contact them by telephone to explain to them what their diagnosis is, what the management plan should be, i.e. do they need to use a splint? Do they need to take analgesia? Do they need to carry out elevation? Do they need to use icing treatment? And what the expected rehabilitation would be. As long as the patients are happy and understanding, or the parents of the patients are happy and understanding, the patients are discharged. If there's any discrepancy or patients are unhappy, we then have a low threshold for patients then coming back. So out of those 2,000 patients, we have somewhere in the region of 600 patients who have not needed to come to fracture clinic. We have saved that amount of time, allowing patients to be seen with more time for them to have their assessments, etc., and also convenience for patients ultimately, and savings ultimately for both in terms of time and in terms of capital for the hospital and the NHS. So if you stay looking at me for a second while I move, what I would do is I'll then go to see a referral for a patient. Well, I'm going to show you this because it's patient confidentiality, but I will. So on this review, I will load up the patient. The patient's been loaded up by accident emergency or the minor injuries unit at Clacton. So I will then look at the patient's, this part here. So I'll look at the patient's clinical assessment. So they were seen in. Patients were seen under the Lucy Booth team at Clacton. Their diagnosis was that the patient had a closed fracture of their fifth metacarpal bone on the right side. The injury was on this state. They didn't think there were any issues in relation to the injury, for example, rotational abnormality, and this is the treatment that they provide, essentially a splint and neighbour strap. The patient injury mechanism was that they punched somebody on Sunday, which is a classic mechanism for this. They had mild swelling, they had pain, and the x-ray confirmed the fracture. This sign means a fracture, and they provided them with a splint. So they then, the referral is pending. I will accept the referral, and then moving down, I'll carry out an assessment, providing them with my assessment, my diagnosis, and if we move to this window here, we can see that on the right hand, on the little finger metacarpal bone, the patient has a fracture. Okay, I'm then able to confirm that is the diagnosis. I'll then look through the reviews and see that the fracture is indeed of the fifth metacarpal neck, and also that it's not malrotated significantly, and the angulation is not severe. So I'll confirm the diagnosis, which is that the patient has a fifth metacarpal fracture. I'll carry out my assessment. Consistent with